Our first presenter will be Sarah Hahn. Sarah joins us from Seattle, Washington, and Sarah is a 2014 ePatient delegate, soon to be ePatient scholar, right, upon completion of this presentation. And Sarah had a post-operative experience, which I'm sure she'll be talking about, an infection that has launched her into advocacy. Did I lose you guys? I think that just died. That launched her into advocacy, ePatient advocacy, and she serves as an advisor for Empower, which stands for Mobile Post-Operative Wound Evaluator. So we welcome Sarah.
Good afternoon, everybody. So my name is Sarah Hahn, and this is my first medical conference ever. I'm so thrilled to be here. I'm also very honored to be called a Stanford Medicine X ePatient, and I want to tell you about how I got here. It was basically a lifetime of essentially being the opposite of an ePatient, a surgical site infection, and a clinical research project. I didn't know it at the time, but that surgical site infection would change my life. It changed what kind of patient I am, it changed how I participate in our healthcare system, and it's also changed how I see myself as a provider in the future. Several years ago, I had surgery, and when I was discharged, I felt rushed. It was just horrible. I didn't feel ready to go home. I didn't get to talk to my surgeon. I got multiple instructions from multiple different nurses. I was high off of drugs, in a lot of pain, and there was just a lot of paperwork to go through. But I felt comfort in thinking that if I wasn't ready to go home and if something was wrong, my doctors would know about it and they wouldn't have discharged me, right? So I got home, and I remember feeling so overwhelmed that when I was trying to organize everything, I just dumped it all onto the table and took a picture of it. So that's what you see here, is just a lot of drugs and paperwork, and this cluster was basically my post-discharge homecoming. And I really focused on just following instructions, just changing my bandages, taking the drugs at the right time, don't shower until day, whatever. And as a patient, I really thought that was my only responsibility, just to follow the directions I had been given. And I felt that I was in a strange limbo where I was still in a period of care, but I was at home, away from care. So as time went by, I realized that something was a little weird. I didn't think I was healing properly. And so I called my provider. And unfortunately, after playing phone tag for a while, explaining my situation over and over again to multiple people, I was told I can wait till my follow-up visit, or if I'm really concerned, I can go to the emergency room. Well, I didn't think my life was in imminent danger, so I decided to wait it out. And I remember just feeling incredibly anxious and alone. I didn't know what was wrong with me or if there was something wrong with me, and it wasn't a good feeling. But I still had this strange assumption that my doctors would know if something was wrong. And as a patient, that's how it was supposed to be. I was supposed to be taken care of. So eventually, it was my family doctor that actually diagnosed my surgical site infection. And interestingly, I found myself wondering, what's wrong with me? What did I do wrong that made my healing go bad? I want to share with you some quotes from research subject interviews. These are all patients that have also suffered post-discharge SSI. I was out of it, just trying to survive. I didn't have a clue what to do with the wound care instructions. If you're worried about it, go to the ER. They never say, come on up and we'll check you out. So as these quotes reveal, I was not alone. This actually happens a lot more than we know. Most surgical site infections occur after hospital discharge. That means that more than half of these infections happen to patients that are at home, out of the clinic, not being monitored by their provider. So the patients that go home are on drugs, recovering from surgery. They're the ones that are left with the responsibility of remaining vigilant, like making sure that everything's okay, and if something's wrong, following up and taking care of that. So reflecting, I guess you could say that I wasn't very engaged in my post-operative healing. And I do want to talk to you about patient engagement, but also patient engagement beyond one's own health. And I truly do believe that you can't get people engaged without knowing why they don't. For me, I come from a culture of a very paternalistic medicine. Patients just aren't encouraged to take an active role in their care, let alone in research and medicine in general. Excuse me. So I always approached medicine in the sense that I don't have the expertise or knowledge. Providers, administrators, researchers, they do. So leave it up to them. And I'm just the recipient of the system. That obviously did not work out well for me. A couple years later, I was volunteering at the emergency department at Harborview Medical Center. That's where I met Dr. Heather Evans, who's actually sitting here today. She's a trauma surgeon, and we started talking about some volunteer research opportunities. And as she was explaining some of the projects that she was involved with, one of them stood out. This was the Empower project. We're working towards making a post-discharge wound monitoring mHealth app. Patients take this tool home after surgery, take pictures of their wounds, fill out some questions about infection symptoms, and send it to the provider periodically. That allows the surgical provider to monitor their patients even after they've left the clinic. We also hope that it will encourage patients to engage in their wound monitoring, and that it'll provide a reliable method of communication that's actually useful to both parties. So I told Dr. Evans, this project appeals to me because I had one. I had a post-discharge surgical site infection too. And she was thrilled. She invited me to serve as a patient advisor on the team. And as a pre-med, I was ecstatic. I mean, that's a great opportunity. Now all I had to do was figure out what a patient advisor was. And at first, I thought that I was going to be advising patients. So I went online and did some research about what the role was, but there really weren't any resources to tell me what a patient advisor was or what they do, or even just the history of patient advisory work. The internet had failed me. And the only thing I did glean from that research was that I wasn't going to be advising patients. I was going to be advising researchers. So naturally, I started wondering, what could I possibly contribute to this team of highly educated, highly experienced professionals? I mean, what are my qualifications to tell these people what to do? And that perspective really did color my initial approach with working with them. I was super hesitant to provide any comments or feedback. I always thought, what could I possibly say that'd be new to them? Well, over time, after sharing a little bit more of my perspective, I realized that things that were obvious to me, it wasn't, and mostly because I had gone through them firsthand, it wasn't intuitive to them. And that was a missing piece. The patient perspective. That was exactly what I had to contribute. My patient experience is my expertise. Patients most intimately feel the impact of conditions, treatments, gaps in the system, and so it's patients that really should help address these things. Or in Empower's case, I can help make Empower an app that patients will actually use, and emphasis on the actually use. And when I think about typical research outcomes that are highly valued by the system, I think of increased patient satisfaction scores, quality metrics, cost savings, etc. And as a patient, those things are all obviously important, but these aren't the things that motivate me to get engaged. These aren't the things that would motivate me to use this app. So what motivates me? Well, reduce anxiety. I don't want to feel alone when I go home. I don't want to feel like there's just an abrupt gap in my care. I want to get back to my normal functional self as soon as possible. And if I'm scared that there's something wrong, I want to be able to reach out to my provider and actually have meaningful communication that's going to lead to something, besides just, you can go to the ER if you want to. So, for example, I can help take Empower to the next level. We can help it go beyond an app that just takes pictures and collects infection symptoms. We can help Empower become a tool that provides peace of mind, that even if I can go home and heal from surgery, my doctor's still watching over me. And I can feel better that I have a method of reliable communication there. Also, I can make sure that patients won't feel that this is a substitute for care, but rather an extension of it. I can help reach these patient-centered outcomes, and I truly do believe that the typical research outcomes will follow. So, Stepping back a bit, I've been involved in this patient advisory world for about a year and a half now. And before then, I honestly had never even heard of this sort of thing. So I don't think it's because of a lack of enthusiasm or the amount of patient advocates out there, but more so because the general population just isn't really exposed. And working with Empower, I've been exposed to these little pockets of patient-centric change, but real change is when everyone changes. So how do we get that? We have to address this history of mistrust. We have to treat relationship building as a part of the work, just like recruitment, just like setting up an advisory board or asking for letters of support. It took me a long time to figure out my role on the team, but I've had the unique opportunity of being involved pretty much since the beginnings of the project, and this continued involvement has really aided in that relationship building. I get to be involved in pretty much all aspects of the project. I get to see all sides of it, and my involvement goes beyond just a periodic consultation of an advisory board. I'm actually a part of the team. There's an environment where I feel safe sharing. I know that my input's actually being heard, and I know that my involvement goes beyond just a checklist where it's just, you can say, oh, our team has a patient advisor. So that's how I'm here as an ePatient, and that really illustrates my journey. I started out as an unengaged patient to an ePatient, and hopefully in the near future, as a patient advocating physician. I cannot believe the impact that my patient experience has had. And that's definitely going to inform my medical education. To remember to always place the patients at the center of my actions, to help my patients feel empowered over their health, and to encourage them to get engaged and contribute to a system that we both participate in. And Empower really has been the catalyst for my evolution. It's completely changed the kind of patient I am and what kind of provider I hope to be. But more importantly, and this is something I want for all of my fellow patients, it's encouraged me to engage. And when we talk about contributing to the system or making change, what are my qualifications? What do I bring to the table? I'll say it again, my patient experience is my expertise. And it's shown me that as a patient, you cannot be on just simply the receiving end of the system. You have to be an active contributor. That shift in perspective has really set me off on a path. I started out involved in Empower out of the University of Washington, extended my patient advisory work to these other organizations, to even serving on an IRB committee out of the Human Subjects Division. And today, it's brought me here at Stanford to share my story about my patient advisory work and to tell you that a patient truly can be an integral part of a clinical research team. Thank you.
Okay, so we have 5 minutes for questions for Sarah. Thank you very much. Would anyone like to begin? Okay, I'm going to ask my questions then. Was that a hand back there?
I have a question.
Yeah.
How would you fall into some of these cases? How would we find these part of insurance?
So that's the challenge of it. I really do think that for the general population, it kind of has to be provider driven, because I don't think that in the general population of patients, we think that intuitively doctors should know what we're thinking, right? Because they see more patients than we do. But I think it's just kind of getting out in the community that patient perspective is really important and it's really useful. And once the general population learns about that, I think it's a lot easier to start looking for research projects. There's ads everywhere, especially if you're in an academic institution, and to just ask, do you guys need a patient advisor? Is there any way I can get involved with research? Because even if that provider doesn't need somebody or isn't looking for someone right now, there's always a huge network behind that. And at least at our institution, I see that there's a lot of providers actually looking, and providers are asking the same thing. How do we get patients on our team? So it's interesting. There's the two parties thinking, how can I contribute? Well, how can patients contribute? And how can I get on a team? And how can we get patients on our team? So I don't have an answer, but it's exciting that both parties are really wanting it. We just have to come up with a way to make it happen.
So it sounds like you heard from your provider about Empower. Is that correct?
No, so it was a coincidence. I was volunteering at the ED, met Dr. Evans. It just so happened that one of her projects was about surgical site infections, and yeah.
I see. Okay, so maybe one place to start would be to talk to your provider about any
Absolutely.
technology. Okay. Great question. Yeah.
Not so much not so much a question, but I was just thinking about the question you asked. And I went to a workshop yesterday by the PCORI program, the Patient-Centered Outcome Research Institute program, and they talked about a new grant series that they're releasing this fall. And in academics, that catches everybody's attention when you say new grant series that they're releasing this fall. They talked about a new grant series that was a staged set of proposals. And the lowest, the initial stage is like a $15,000 grant that one doesn't have to be an academic institution to apply for, that a patient could apply for, that anybody with a good idea can apply for. And then PCORI is going to help kind of nurture finding partners to work with and developing that into a full-fledged grant. And so I think that it's kind of interesting to think about, your comment, ask your provider, but I think there's lots of people in foundations and government who are kind of looking for people who are willing to get engaged and looking for those good ideas. So I see you're writing the PCORI thing down. That's good. but I also think, it sounds like Sarah went out looking on her own, and that's good. And if you're in a university, that's an easier thing to do, maybe. But anyway, so I don't think there's a question in there.
I don't have a question either, but I will say that there are a lot of patient support groups that act as patient advisory groups. So if you're in a support group for a particular condition, researchers are going to seek you out. And that's happening more and more because of PCORI and the shift towards patient-centered research.
Thank you. And another shameless plug for the ePatient program. You could become a Stanford ePatient. Please apply.
So that actually brings up an interesting point, because the support group thing, I think that's an incredible resource. But from my point of view, I had an acute situation, and a lot of the support groups revolve around chronic conditions. And so for patients facing acute conditions, you just try to get through it. And then once you're done, you move on. And that's really where I was. After my surgical site infection, I wasn't thinking, oh, what can I do to change the system? This opportunity just came, and I realized that I could contribute there. So that's something that I think we need to address too. How do we get patients that have recovered from acute situations involved, to come back and get involved?
Absolutely. Do we have any other questions? I'm going to pose one of my own. So could you tell us how this kind of worked? They're building a product, it's got a certain flow, and then they come to you for your input. Do you have a specific example of where you maybe changed one of the features based off of your patient perspective?
Yeah. So coming from an academic institution, I think a lot of it had to do with first laying the groundwork, realizing what's the problem. So is our surgical site infections happening post-discharge? Is that a real problem? And so a lot of it was trying to find out the patient perspective. What do the patients face? Especially because if it's a post-discharge situation, the providers don't really know what's going on at home, right? And that's part of the problem. And so I was obviously able to provide a lot of input there, what the experience is like for a patient. And also one of the things in particular I remember, one of the first things I said was, so this tool, it could really come off as being a substitute for care. Like maybe my doctor just doesn't want to actually talk to me. That's why they're just handing off this app. But that's really not the intention of it. It really is an extension of it. And having those sort of perspectives helps you shape and design the tool in a way where it's going to be better received and you're getting your intentions across better.
Absolutely. And providing a better experience for you patients, right? For patients. All right. Well, we'd like to give a round of applause for Sarah. Thank you very much.
Thank you.